Good afternoon. I have 8 minutes to introduce you to my PhD thesis, The Risk Factors of Atherosclerosis in Obese Patients. My name is Judit Eleonóra Nagy. I'm a first-year PhD student here, and in my other life, I'm also working in the pharmaceutical industry. I'm responsible for market access and pricing. So this is the reason you might say that the choice of my PhD title is a bit biased, and you might be right, because actually in my everyday work, I'm working for the GLP-1 pricing and reimbursement issues. So it's a bit trendy, but I think it's very important, and I truly believe that in case of obesity, the real question is the prevention, and the real answer is also the prevention. It's not the treatment itself. But we need to have a stronger clinical practices, and we need to have a better management of severe risk factors regarding obesity. So my first project will be a systematic review and a meta-analysis. I would like to investigate the lipid profile of the different obesity phenotypes in relation to the atherosclerosis prediction. In my second project, it's very similar in setup. However, I will have a different angle because I will investigate the inflammation panel, the inflammation profile of these subtitles. And I'm also very much enthusiastic to participate in the Eurostat project, where I would like to have some statistics for the overweight and obese patients' work absenteeism, or the productivity lost they have suffering from the comorbidities or from the obesity. So about my first project, I think it's fair to say that we live in an obesity pandemic, and it's really become a global pandemic. With far-reaching consequences, not only for the individuals, but also for the healthcare system as well as for the economies worldwide. Obesity is very closely linked to atherosclerosis, as obesity being the major risk factors for the development and for the progression of the atherosclerotic plaque. And atherosclerotic diseases like myocardial infarct or stroke are a #1 killer worldwide. So you see the importance and the plot of the story here. Obesity contributes to atherosclerosis through several mechanisms. The first one is the chronic inflammation. I will deal with this one later on in my second project. And now I would like to discuss a little bit about the metabolic dysfunction. So obesity is associated with insulin sensitivity or resistance, also abnormal lipid profiles, and endothelial dysfunction. Actually, obesity is really a heterogeneous condition with varying manifestation among the individuals. And obesity subtypes, in very simple terms, refer to the ways how obesity affects someone's body and also how they affect their health. There is a very interesting subtype, it's called, or phenotype, it's called the metabolically healthy obese patients. These patients have normal level, favorable level of lipids, they have preserved insulin sensitivity, and they have a low inflammatory marker panels. Their only problem, or I would say the problem of the clinician, is that they are obese. So the clinical question here is that what to do with these patients, how to treat or when to treat, and what kind of intervention do we need to treat those patients. So my clinical question for the first project will be that, is there any lipid biomarker, and if so, which lipid biomarker have the highest predictive value for atherosclerosis in the obesity patients? I will use the PFO framework, I will use the population as overweight and obese, and the outcome, I will use the atherosclerosis, the coronary artery calcium, which is a really good marker. It's assessed by computer tomography, and it's a well-established and very strong risk assessment tool, actually. So this is my first project. These are the final search keys. I have already conducted the search. And as you can see, I have almost 30,000 hits in the beginning. Then after the duplication removal, I've got a little bit over 19,000 articles, which we are working through very diligently with my co-author, and hopefully I will get there very soon. I just wanted to show you that it is indeed a very trendy subject. There are many new meta-analyses in this subject. However, I really believe that our research will add to the subject because we will get some individual lipid data, and we will have a whole session of meta-analysis on this subject. So this is the progress. I hope to finish the title abstract by this week. Regarding my second project, as I mentioned, it's very similar in setup. However, this time I will examine the inflammation markers. Regarding obesity, there is a constant, slow, low-grade chronic inflammation ongoing in the body. And the key features here are the elevated level of inflammatory cytokines like the TNF-alpha and the different interleukins. And also there is a shift from the anti-inflammatory macrophages to the pro-inflammatory macrophages. So here my hypothesis is there are indeed some certain biomarkers which have higher accuracy that can predict the development of the atherosclerosis in obese patients. So I would like to examine these. However, with this project, I'm just in the beginning, so I already have some high number of hits, and later on I will get into this subject. So just a couple of words about the Eurostat project. Until this moment, I have been discussing the obesity-related poor health outcomes. Now I would like to switch gears and go into the social economics impact of obesity. And I would like to examine the obesity-related work productivity loss, or to be very exact, how much do patients miss or workers miss because of their obesity or the comorbidities. So in the Eurostat questionnaire, there are some specific questions for that, and I would like to have some answers for this. Our hypothesis here is that workers with obesity have much higher work absenteeism compared to their normal weight counterparts. So this is my three project, and I think that I am among the oldest here in the room, so I can proudly quote Einstein: intellectual growth should commence at birth and cease only at death. Thank you very much.
Thanks for your presentation. Regarding obesity, is there any difference of the definition around the world?
Yes. First of all, I mean, nowadays we use the BMI. It's not a perfect measurement, of course, so it has been criticized a lot. And for Caucasian people, the cutoff for normal weight is 25. However, for example, for Asian population, it's much lower. It's about 23.
Hi, thank you. First of all, great presentation. Second of all, my question would be, what specific lipid markers will be included in your study?
So the traditional lipid markers like total cholesterol, HDL, LDL, and triglyceride will be there. And if I get some individual data, then I can use the non-traditional lipid markers as well for further examination.
Okay. Congratulations on your presentation. I have one question concerning that you told that there are different phenotypes of obesity or being overweight. Is it related to the location of the adipose tissue, like, I mean, abdominal adipose?
Yes, it's more recently, as I mentioned, the BMI is not considered to be a precise measurement. They use rather the weight circumflex. So that's one measurement, but also the body density is more often examined, and there will be some newer and newer ways how to measure the exact body fat percentage.
Thank you for the answer.
So my question is from a cost-effectiveness perspective. Do you see any ability to stratify patients on the basis of potential response and benefit using your biomarker approach?
Yes, I think that regarding cost-wise, the best would be to find a biomarker which could be easily and cheaply used, and that would help definitely the policy makers to make up their decision to stratify obesity as a disease, because currently it's not recognized as a real disease, of course, because it has a huge impact on the budget, on the healthcare budget. I think I'm answering your question.
Yes, you are. Thank you.
So that would be the main point, is to have one precisely or one or two that could be easily identified then later on.
Thank you very much for your nice presentation. And I am a clinician, so I have a clinical question. That what do you think we should focus on, the metabolically healthy obese in clinical practice, or we should focus on the metabolically unhealthy obese?
It's a good question. It's regarding that there is a difference that how often do you see a metabolically healthy obese patients, because it's possible that they do not go to the doctors because apart from being obese, they don't have any other problem. However, it will definitely change. So you as a clinician, when you do the risk stratification of those people, because their lipids are normal, their blood pressure is normal, you would have an immediate low risk categorization, but that will certainly change. So something has to be done with them. However, you're already seeing those patients most probably who are metabolically unhealthy but normal weight. And most probably you will treat them with statins or whatever it's needed.